Hi guys, it's Dave. Today we're going to talk about conjunctivitis or pink eye, which generally when you think of pink eye, it's not necessarily just any type of conjunctivitis, but more along the lines of bacterial conjunctivitis. There are several different types. There is allergic conjunctivitis, which occurs when certain things hit the air, whether it be pollen, dust, dirt, chemicals, and your eyes will become red and inflamed and watery. They can be painful. The main thing is they turn really red and they can itch. That can be treated with over-the-counter antihistamines oral like loratadine, cetirizine, which is generic Zyrtec, or Allegra, along with eye drops like Aloe or Zatador or the generic or Pataday, that you can all use in conjunction with actually the oral tablets as well. Then you also have conjunctivitis, which is caused by bacteria. In that situation, it gets a little more severe. You kind of get the sleep eye, where when you wake up in the morning, you can't open your eyes because you got so much sleep and matter on your eyes, they're shut. Really freaks you out when you're a little kid. All you need to do is take a warm, moist wash rag to wipe it off. If that's a situation, most likely you're going to need an antibiotic to actually get it cleared up right away. There are several different types of drops and even a couple of ointments that can help out with that. Some of the drops you want to be careful, especially if you have an infant or a young child, because it's not indicated for them, where other ones are. In fact, with the bacterial type, most schools will not even allow your children to come back into school if they have a case of the pink eye. So you want to get them started on an antibiotic. Generally, they're not going to be contagious after like 3 days, but most schools will tell you that you have to complete it, which can be from 7 to 10 days. The one thing you want to watch out for is one eye may be infected, and that antibiotic may be clearing it up, but the child rubs the eye or something happens and then the other eye gets infected. So in which case you may have 3 days gone here, but you just started here. So you're starting over with the fact that the child is contagious. And it is a very highly contagious situation with pink eye. Other things that can cause conjunctivitis is actual injury to the eye. If you get a large particle in your eye, you take a blow to the eye and it becomes painful, it becomes watery, it becomes itchy, red, and it doesn't go away after a couple of days. Get into a doctor, an ophthalmologist, let them take a look at it, see if there's some damage that has been done. Tear ducts can also become blocked, which will cause irritation that can lead to the conjunctivitis as well. In that situation, again, it's something you need to get in for an office visit because nothing really can be done about that. For bacterial, viral, and allergic conjunctivitis, most of those will go away on their own without any treatment after about 7 to 10 days. It's just that you have to put up with the irritation, so it's a lot easier to actually treat it and get it taken care of. If you do get an eye infection caused by one of the sexually transmitted diseases like chlamydia and gonorrhea, that's the most serious situation you can be in. It requires topical and oral antibiotic treatments to actually take care of it, and it needs to be monitored because you will have a very high risk of corneal perfusion or perforation, which can lead to limitations in your vision. So if that occurs, you want to get in, make sure it gets diagnosed and get started with treatment. The other thing that can occur too is you can get shingles that can spread into your eye. And that is a situation too where you can have visual limitations put upon you, and if it gets severe enough, can lead to some blindness. So in that situation, you really want to get started on an antiviral as soon as possible. Some of the things that you need to remember if you do get this. Number one, if you're wearing contact lenses, throw them away if they're disposable or short-term lenses. If they're long-term lenses or hard lenses, make sure that you clean them and sterilize them as instructed by your contact provider. It's very important because if not, you will do nothing but continue to reinfect that eye. And the entire time that you have the treatment for the conjunctivitis going on, you should not be wearing your contacts at all. Wear glasses instead, and I generally recommend that for about 4 days after everything is cleared up, just to make sure, because like I said, one eye gets infected, and then guess what? Sooner or later the other eye sure can too, and you don't want to waste contacts and cause problems with reinfecting one or both eyes. The other thing, which is easier said than done, is avoid rubbing your eyes. That's the surest way to get both eyes infected, as well as transmission to family members and friends as well. If you're treating your conjunctivitis with eye drops, make sure that you do not touch the dropper itself to the eye, because when you do that, you've contaminated it, and it's very easy to get the second eye infected as well. And with the lid, make sure where you're placing your lid, because if you put your lid down on the counter and you've had any contact with that countertop and you screw that lid back on, you are contaminating that eye drop. Better safe than sorry. If that eye drop is contaminated and it's not a very expensive one, get rid of it, start over with something else. We have a great video on how to put in eye drops on our TikTok that you should check out. As far as any long-term serious consequences, other than the corneal perfusion that I discussed, or the case where you get shingles into the eye, it's very rare to have serious issues that actually affect your eyesight. It's more just a pain for the amount of time you have, with the redness, the itching, the pain that can occur, and then with the watery eyes that you can get from allergic conjunctivitis, or the actual white to yellow discharge that you see with bacterial conjunctivitis. Remember, if it lasts for more than a couple of days, the quickest and best way to treat it is to get into your doctor or eye doctor and get a prescription and get a hold of things.